Let's start off with chapter 16. Might as well going over. So chapter 16, you guys will recall it was the endocrine system, it was hormones. So make sure that you guys remember some of the glands that produce those hormones, be able to identify them. If you guys recall the adrenal gland, pituitary gland, pineal gland, hypothalamus, make sure that all of those glands you can identify them on the picture. Okay? I think there's a picture in the first or second page of that chapter. Kind of has all those glands templated. Make sure to go over that picture. That's all we have in there. You can imagine. The next thing to know after that, be able to know what those glands produce. Imagine they're putting like a hormone there, growth hormone. And again, you're going to have to match it with the gland that's producing it. Thyroid hormone, aldosterone, make sure that you know where these hormones are being produced. Okay? Again, it's probably going to be matching. Other than that, the diseases, a good example being, say, Graves' disease, Addison's disease, Cushing's disease, basically any of the diseases that are in there, make sure that you go back and look at them, know the function, the definition, what are the hormones that are causing it, and say, like, is it an excess of a hormone? Is it a deficiency of a hormone? Again, it's probably going to be matching.
I wasn't hungry.
No questions so far on this?
No.
Just keep going. Moving on into the immune system, guys. Well, blood. The white blood cells were divided up into two groups, I believe. There was granulocytes and granulocytes. I don't know if you guys remember that. There were 5 total. Neutrophils, eosinophils, basophils, lymphocytes, and monocytes, right? I'm going to have all 5 of them there, and you guys are going to have to be able to match them with their function. Okay? What they end up causing, what they end up defending from. Alright, let's keep going then. The diseases here. You guys will recall leukocytosis, leukemia. I think I even told you for the exam about that. All of those emias. Know them? Yeah, you guys are pretty much going to have to know them. I'm going to randomly pick some of those. Cystoanemia, pernicious anemia, polycythemia, all those. And some of those are going to be on there, and you guys are going to have to match it. Okay. Exciting. Question, guys? Alright, let's continue. The electrical conduction system of the heart. You guys had to know what the SA node, node, atrioventricular, bundle, right? All of that stuff, be able to perhaps not identify it, because they're probably not going to have that picture, and that's what deciding, but be able to know what's going, like, what each of those things causes. I believe the SA node causes the heart to beat at a certain rate. I think 75 beats per minute or so. The AV node is a little bit less. Be able to know what happens if you end up having a heart attack and the AV node gets basically shot, like no longer functioning. Is the heart going to be able to function?
No.
Again, be able to go over each of these conditions. Guys, you all should be familiar by now with the entire blood flow of the heart. I'm probably not going to ask you to label the heart, but I might ask you questions like, okay, when the ventricles are contracting, which, by the way, is systole or diastole?
What?
Systole. Oh, yeah. Systole is contraction, diastole is dilation, right? Yeah. Okay. When the ventricles contract, remember, be able to know what's happening. Are the valves open? Tricuspid, bicuspid? Are the semilunar valves open? Are they closed? Again, know what's happening when the heart contracts and relaxes. Hey guys, sorry, sorry. You guys should also be familiar with the fetal blood supply. Recall that the fetal blood supply is slightly different than ours. Blood actually travels slightly differently. There were 3 kinds of bypasses there. The ductus arteriosus, ductus venosus, the foramen ovale. Know what each of these bypasses connect. Know what they're designed to do. Okay, I'm probably going to have one of those on the exam. Probably know what they do. Know what the formula is for cardiac output. You're probably not going to have to calculate anything with this, but you probably are going to have to know how to determine cardiac output. Okay. Bradycardia, tachycardia, should be familiar with that. The tunica, guys, the blood vessels. You guys remember the tunica intima with media external? Again, be able to know which vessels contain that. The capillaries have all 3 layers. No? the formula for mean arterial pressure, you will have to calculate a problem with that. It's not that difficult, but again, you do have to know the formula.
Mean arterial pressure?
Mean arterial pressure. Alright, let's keep going here. Alright, now we're moving on to immune system, guys. Know what interferon is? Complement. There were several kinds of T cells. Cytotoxic, what was it, T helper, T regulatory. Make sure to go through those because I'm probably going to have a matching on that. Antigen presenting cells, be able to give examples and be able to tell me what they do. Okay? There was a picture of an antibody back on your last exam, not last exam, maybe 2 exams back. It looked kind of like a Y. You guys have to identify it. Be able to go with that picture again. In all likelihood, you're going to have that picture again. And chances are it might be the same exact one. Okay, now we're moving on to antibodies, the 5 classes. I don't know if you guys remember MAG, immunoglobulin M, A, E, G, E. I'm going to put all 5 of them on there. You guys have to identify the immunoglobulin with the function. Okay, question? Alright, let's keep going. Again, be able to give examples of antigen-presenting cells. Autoimmune disorders, guys, know how they're caused. Also give examples, because I'm probably going to have either a question like, which one of these is not an autoimmune disorder? A, B, A and B, all of the above, none of the above, or which one of these is an autoimmune disorder? So you're probably going to have to know at least some examples of them. Okay. See what else we have here. Okay, respiratory system now, guys. No pulmonary ventilation. What is it? Inspiration, expiration. Like the first few pages or so, it talks about the parts of the respiratory system, and the other 2 parts in the first page, I think, talk about the functions of the cardiovascular system, moving oxygen and with other ways. Make sure to go over that. All right. The alveoli, guys, they're composed of 2 types of cells, type 1 and type 2. Make sure to go over those cells. I'm probably going to have either one there. So make sure that you do know what each of those cells does. Okay. Make sure you guys know what surfactant is. Okay.
How do you spell that? Oh, yeah.
Intrapulmonary pressure, guys, no definition. Intrasternal pressure. What else? Make sure you guys know the muscles that are used for inspiration and the muscles that are going to be used for expiration. I think I told you guys about those. And know which one's relaxed, which one's contract. The Bohr effect. This isn't actually something that we talk about too much in here. I think I might have just mentioned it. Make sure that you do go over it. B-O-H-R, the Bohr effect. It deals with acid and base regulation. Also, what's the most important stimulus for breathing, guys? Is it breathing in oxygen or getting rid of CO2?
Getting rid of CO2.
There you go. That's right. Okay. Everybody close to this. Oh, there's 2 paragraphs, guys, relating to oxygen and CO2 concentrations in the blood. I think we talked about how oxygen was balanced to hemoglobin, 98.5%, something like that. 1.5% was in plasma. CO2, I think it was 70% in bicarbonate, 20% in hemoglobin, something like that. Make sure to go over those 2 paragraphs that talk about oxygen and CO2 in the blood. Okay. Total lung capacity, learn that formula. I'll tell you right now, it's incredibly easy. But just do learn the formula because you're going to have to calculate the numbers there. Keep on going. Alright, definitions, guys. Know what tidal volume is, inspiratory reserve volume, expiratory reserve volume, residual volume. One of those 4 is probably going to be on the exam. Just pretty much a straight out definition. Alright guys, urinary system, which you guys just took, so you guys should be experts on this by now.
No.
Ptosis, make sure you guys know what that is. P-T-O-S-I-S, ptosis. Make sure you know what that condition is. Formation of urine, guys. Those are 3 steps. glomerular filtration, tubular reabsorption, tubular secretion. Make sure you guys go over those again. Probably gonna have questions on those. All right, what makes up a nephron, guys? What do you think?
Juxtamen.
Glomerulus?
Glomerulus.
And
Renal
capital.
Tubular, right? Glomerulus and renal tubule.
I got that wrong.
Let's see here. Alright, so that's the rectum, peritubular capillaries. Make sure you guys recall which two nephrons have which, right? There's cortical and juxtamedullary. That's the rectum and peritubular are found in one or the other, not in both. Right? The blood vessels, guys, you're probably not going to have to know the, like, in other words, for this one, I'm probably not going to put a picture of the kidney there, but I'm going to ask questions like, okay, which blood vessels are found in between the cortex and the medulla? Probably those are going to be the arterial, because those are along the edge of the pyramids. Or I might ask a question like, which of the blood vessels are found in between the medullary pyramids?
Interlobar.
Those are the interlobar, right? So again, it's probably going to ask a question like that. Continue then. Know what JG cells do? Juxtaglomerular cells. Macula densa, know what they do. Also be familiar with where they're found. I'm probably going to ask you questions on that. Go on, I guess. What gland is on top of the kidney, guys?
Renal.
Alright, finally we get to the last one, reproductive, which we barely touched at all, mostly in lab. These are some of the questions that you guys can have for this. You guys are only going to have 8 for reproductive, by the way. It's going to be learn what FSH and LH do in both males and females. Good question, yeah. Make sure you guys know what FSH and LH do in males and females. Semen, make sure you guys recall the 3 glands that are used in the production of the fluid for it. Ectopic pregnancy. Make sure you guys can give the definition for that. Chances are you're probably going to have that one as well. Uterus, guys, you should be familiar with all 3 layers. I know we actually didn't cover this too much, but it's parametrium, myometrium, and endometrium. The bottom layer, the endometrium, is composed of 2 layers itself, right? Stratum basalis, which is the deep one, and the stratum functionalis, which is the one that gets shed during menstruation. So just be familiar with the different layers. Where does the egg get fertilized most of the time?
Ovaries.
Fallopian tube? Sorry, Anthony, where did it plant? Uterine wall, uterus.
I got all that.
Okay. For the male reproductive system, for the penis, be familiar with the structures that fill up with blood. I think I told you guys there were 3 of them. Well, corpus spongiosum, corpus spongiosum, and 2 pulchra tabulosum, right? Be familiar with them. Which one contains the urethra bladder? Spongiosum. Guys, that looks like that was it.
How many questions are you going to be on?
100, 1 point each.
Nice.
Well, you might have also noticed there was no digestive system in there. I kind of removed it. It was just a really good chapter.
That's kind of smart.
But that's it.
Hey, sir, can I YouTube this?
Can you YouTube this?
Yes, because I just want to put it on YouTube so I can have it on the computer.
For not, yeah.
Just till Thursday, not to take it off.
For what?
Just so I can have it on the computer, not on my phone.
Yeah, I guess.
Thanks.